Okay, so before you fit the cast, you obviously have to measure the cast. Okay, so what we're looking to do is you use the Weberall underlay as your measuring stick, and what we're looking for is the distal palmar crease, which is here, and 2 fingers distal to the cubital fossa. So you use your Weberall to position at the top, and then you just gently motion down to roughly 2 centimeters above the cubital fossa, and there you have your plaster cast length. From there, we then have that ready to fashion your cast. Then we must wrap the patient. Okay, there are many different ways to wrap the patient. I like to start off at the thumb. I make a nice big hole for the thumb, and then we're using gentle tension with the Weberall to create a nice layer of underlay with the Weberall between the patient and the cast. Okay, it needs to provide comfort, but it also needs to be fairly conforming to the skin so that you get good immobilisation from the cast. When you're wrapping, half wrap each time so that each part of the skin has got at least 2 layers of the Weberall all the way along. It's better to over wrap slightly, coming a little bit further down, that way you can fold it back after you have applied your cast. And once you've fitted it, I like to apply a small piece at the thumb, fold it over like so, and then you sometimes need a bit of extra support over bony prominences such as the radial styloid or the ulnar styloid. I also like to do another small piece which gives a nice neat finish at the edge of the cast here. After you've applied your Weberall, always do a thorough skin check to make sure there is no windows where you can still see any skin. That looks good. Now we move on to the cast itself. Here is your finished article. The way that you get to this point is you need to measure from the distal palmar crease down to the thumb. I like to use my fingers, so it's roughly my index finger or 3rd finger there. You make a fold 1/3 of the way along your plaster cast. For Suzanne, we're using 10 ply, but you can use anywhere up to 15 ply, so 15 layers of plaster. I've placed my finger at the top of the cast, and now you are cutting a small triangle So there we have that, and then you can make 2 cuts at the bottom just to give it a nice neat finish, and then I'll make 2 smaller triangles at the top, and there is your finished trauma slab which is ready to go on. From here we now are going to immerse the cast in the water. This is cold water. You must never ever use hot water because that will tend to go off in half the time. So with cold water, there are different ways of doing this. I like to dunk for 4 seconds and then hold for 20 seconds in the air. Do not squeeze the cast, do not wipe the water off because all of the plaster will end up in your tray. After the 20 seconds is up, a couple of dips on the towel just to get any excess water off, and you've got a workable plaster cast from there. So with a radial slab, the long edge goes along the dorsal aspect of the forearm. Position it onto the thumb. Making sure that you're getting a nice even fit, and once it's nicely in position, just gently smooth onto the surface of the forearm, making sure there are no sharp edges from any of the corners, and making sure there are no areas that are touching exposed skin. Once you're happy with that, you have a simple crepe bandage and now you're ready to wrap. I start at the wrist, but again, as long as you're using a safe technique which gets good coverage, you can do it however you deem appropriate. And again, 2 layers of crepe over the whole forearm is what we're aiming for. And then you work your way down. A bit of patient participation. Just pop a finger on there for me, thank you. And then you're finished there. So the cast is now applied. The most important thing now is to position the forearm in an appropriate fashion. So with a radial fracture, we need some ulnar deviation and some flexion. When you are positioning a cast, never ever use thumb pressure or finger pressure. Always use the heel of your hands so as to not create any pressure points. And that's good. This cast will be hard in about 15 minutes, but it takes 48 hours to get up to peak strength. I normally leave it for 10 to 15 minutes to dry before making it look neat and tidy, ready for the patient to go home. In order to do that, I get some simple surgical scissors, very, very carefully because you're close to the patient's skin. Make 2 cuts in your web roll. And then you can fold back the web roll to give your cast a nice neat finish. And as you can see, by folding the web roll back, it gives a much neater finish to the cast. And then with this tape, which is slightly elasticated, it gives you good coverage whilst taping that down onto the edges of your cast. And then just a small piece at the other end to finish your cast off. And there we have it, the finished article.